from the station that's on your side. This is Channel 7 News Daybreak.
Hopefully, part of your holiday weekend meant jumping into a pool or a lake here in the state. And if you've got some pain and discomfort in your ears as a result of that, then you probably need to pay close attention to this. Joining us this morning to talk about getting you back in the water is Baptist Health Dr. David Gerson with the Sherwood Family Medical Clinic. Dr. Gerson, great to see you as always.
Good morning.
Tell me about my experience with Swimmer's Ear. A lot of people here in the state have experienced that before due to the fact that we have a lot of lakes, a lot of rivers, a lot of outdoor activity. It's something you've probably seen a lot.
Of course. We want you to enjoy them. We talk about the cure. That's, you got to see your doctor. He's got to get you some antibiotics. He's got to, give you some medications to help cure that. What I always talk about is, the ounce of prevention is worth a pound of cure, right?
Yes.
That's the old saying. So, Swimmer's ear is another term for otitis externa. And if we can get a picture of the big ear diagram here, which I wish I had this in my office. Very cool stuff.
You can zoom in and out, too.
What we're talking about is just that canal right here.
Okay.
This is kind of where that water will go into.
Yeah.
There's also, which we're not showing, and it's natural, is earwax.
Yeah.
Cerumen is the term for it.
Which is a good thing.
It's a good thing, and the problem is most people get freaked out about it and are always trying to clean it out.
Yeah.
And that is actually that can start one of the problems because, the dreaded, the Q-tip here, which, folks will kind of come into that canal to try to clean that out, but what they're also doing is they're scratching up the inside of that canal, and that puts the tissues at risk of getting infected. Then you jump into the pool, you jump into the lake, you get water in there that has some bacteria in it. Bacteria loves moist, warm, dark places.
Lovely.
Then you get your otitis externa.
Okay.
And so the ear will get red, the ear will get swollen, the ear will get very painful.
So you can see it too as well as feel it.
Once you get to the seeing part, it's probably been several days.
Oh, okay.
And so if you and the big thing also, adults, we know if the ear hurts, we know how to describe that. A child, we see it a lot most of the time in children because they don't know how to describe the inside of my ear hurts. Things just hurt and they're just grumpy and they're just irritable.
It's not a typical thing too where you say, just go get some NyQuil, or hey, if you have a sore throat, there's so many, there's so many over-the-counter drugs for it. Ears, it's truly, you got to go see a doctor.
You got to go see the doctor. Now, there is an ear drop. They sell several brands of them. They call them Swimmer's Ear drops that you can get, and they're over-the-counter, but they're really for prevention, okay? And they're usually, they're basically a vinegar-based or a hydrogen peroxide-based. These are diluted medications, but they're really good for after swimming. Before swimming, but before you get the infection.
So once you get the infection, once the real pain has started, that's when
Then I'm going to recommend you come and see your doctor.
Okay.
Absolutely. A couple of other things, remember Grandma says nothing, smaller than your elbow in the ear. So don't stick your finger in there. Don't stick the Q-tip in there. I see people take nails and fingernail clippers and paper clips. They're in there kind of scratching away. You're injuring the lining of the ear, and that's going to set you up for the infection.
Okay.
The other little tip is after you go swimming, go home, pull back that ear. Mom can pull back the ear. Take a blow dryer on warm setting, not hot.
Okay.
Just go back and forth for about 30 seconds. That'll dry out that ear, and then you can put some of those swimmer's drops in there to kind of prevent that.
Okay, and as always, like you said, go see your doctor if the pain persists. There's the Baptist Health line on your screen. Dr. Gerson, always great to see you. Thanks for coming in.